I'm going to be talking about the different types of lung cancer, pathology, and risk factors associated with it. Lung cancer is split into two major categories. Small cell lung carcinoma, this makes up about 15% of lung cancer cases. This is a fast-growing type of lung cancer that's commonly caused by smoking. It starts in the bronchi and creates large tumors that'll spread throughout the body. The second type is non-small cell lung cancer. This is the most common type, making up 85% of lung cancer cases. This type of cancer grows slower when you compare it to small cell lung carcinoma. However, it usually spreads to other parts of the body before you start having symptoms that'll cause you to go get diagnosed. It is then further split into three categories: adenocarcinoma, which is the most common form and usually begins in the outer regions of the lungs; squamous cell carcinoma, which tends to cause early symptoms and usually begin in the bronchial tubes; and large cell carcinoma. This tends to grow rapidly and cause late symptoms and usually begins in the outer edges of the lungs. Pathology of lung cancer is an exposure to carcinogens that lead to dysplasia of the lung epithelium. If the exposure is persistent, it can cause a genetic mutation that affects the protein synthesis. This causes the formation and growth of cancer. I included a picture of what normal cells will look like when compared to dysplasia. Normal cells roughly all have the same height, shape, size, and line up the same. However, dysplasia, you can see in the picture, they don't line up, they stack on top of one another and have different shape and are different sizes. So, as you can imagine, this will make it hard for the cells to do what they're supposed to do. Dysplasia does not cause cancer, but it makes it really easy for cancer to develop because your cells are already not doing what they're supposed to be doing. Some risk factors associated with lung cancer are air pollution, radon, diesel exhaust, asbestos, other chemicals, genetics, and secondhand smoke.
One way to diagnose lung cancer is a CT scan. A CT scan combines X-ray images taken at all angles around the body and creates a closer look at the tissues, bones, blood vessels, and soft tissues in the body. Another way to diagnose lung cancer is an MRI. An MRI uses radio waves and strong magnets to create images of the soft tissues in the body. These can be used to see if lung cancer has gone to other areas in the body. A PET scan uses fluoride deoxyglucose injected into the body to essentially make the cancer cells light up. It is also useful to see if cancer has spread to the other places in the body, just like an MRI. After a CT, an MRI, and a PET scan, if it is suspected that there is cancer in the body, the doctor may request a biopsy of the tissue to confirm the diagnosis that that tissue is or is not cancerous. One medication used to treat lung cancer is angiogenesis inhibitors. These stop the formation of new blood vessels. Tumors need new blood vessels to grow. One example of these medications is Avastin. This is used in combination with chemotherapy or immunotherapy. Another medication used to treat lung cancer is KRAS inhibitors. These attach to the protein that helps keep cancer cells growing, and it inhibits them from growing anymore. One example of this medication are Lumakras. It is used alone if the person has already received one other drug treatment to treat the cancer.
Nurses play a vital role in providing care for lung cancer patients. Interventions include respiratory support, pain management, health and lifestyle promotion, as well as education and supportive care. One of the most important roles nurses play, however, has to do with improving gas exchange. Nurses ensure the patient is receiving adequate oxygenation by monitoring oxygen levels, administering respiratory treatments, and implementing breathing exercises to enhance lung capacity. Another important role nurses have is managing pain and discomfort for lung cancer patients. Routine pain assessments, Administration of analgesics and the incorporation of relaxation exercises enhance the overall comfort of these patients. Bronchodilators and expectorants facilitate airway clearance and improve respiratory function. Along with these interventions, maintaining a patent airway clearance is fundamental in caring for lung cancer patients, especially those receiving certain treatments or undergoing surgery. Chest physiotherapy, postural drainage, and suctioning are used to prevent airway obstruction. It is also the nurse's job to not only care for the physical aspects but also the emotional and psychological needs. Nurses provide emotional support and provide education about their treatment as well as expected outcomes. Patient education empowers individuals to participate in their care. Nurses should provide information about the disease, provide treatment options, and educate on potential side effects. Promoting a balanced diet is an important component to support overall health and aid in the recovery process. Educating patients and their families on these lifestyle modifications, as well as smoking cessation and daily exercise, promotes overall well-being.
As nurses, we strive for our patients to maintain comfort, to be alleviated of pain, and to have a quality of life. One of the top priorities to achieve this is by relieving respiratory distress. A nurse can intervene with respiratory distress with oxygen therapy. By providing oxygen supplementation to the patient, it will decrease the workload on the patient's lungs and can decrease their pain caused by the depletion of oxygen. Another way we can reduce dyspnea is by encouraging the patient to use an incentive spirometer. Using an incentive spirometer can decrease the chance of a patient developing a collapsed lung. Incentive spirometers also facilitate lung expansion. The first step to promote the use of an incentive spirometer is to show the patient how to use it. Remind the patient to tighten their lips around the mouthpiece. Inhale, hold their breath for about 5 seconds, and slowly exhale. Another intervention to reduce dyspnea is with breathing exercises. Breathing exercises include pursed lip breathing and deep breathing exercises. Like incentive spirometers, breathing exercises can decrease the risk of a collapsed lung. Breathing exercises can also increase a patient's ventilation and oxygen levels. Patients strive to keep their independence as long as possible, and as nurses, we make it our priority to assist them with that goal. To help patients with lung cancer maintain their independence, we encourage activity as tolerated. Walking the patient through setting small goals of activities allows the patient to still have control and independence without overexerting themselves. Over time, if the patient is meeting their small goals, activity can slowly increase. Unfortunately, fatigue is a harsh symptom that comes hand in hand with cancer. Promoting time to rest is an important intervention to keep independence. When a patient is having a good day or tries to push themselves farther than the body can tolerate, it can have adverse effects. To reduce this from happening, a nurse would want to encourage periods of rest, typically for an hour and a half at a time. This way, the body can restore its energy. In combination of tolerance, activity, and rest, another important intervention is nutritional support. With different types of treatment, a patient can become nauseated and their sense of taste may change. Assess what foods a patient likes to encourage them to eat. Also, having supplemental protein and calorie options like boost shakes can increase their calorie intake. Another option to encourage intake is by breaking up larger meals into 6 or 7 small meals throughout the day.